What's up, guys? It's Dr. Seth, and today we are back to help you solve your powerlifter problems, specifically knee pain, and even more specifically, if you're dealing with pain in this little tubey, fleshy thing that runs between your kneecap and your shin. And when we're talking about patellar tendon pain, some of the concepts are going to be universally applicable across every tendon. Some of the concepts are going to be more specific to the knee, especially when we're talking about modifying loading of the knee to modify how that tendon is being loaded. But first thing I got to get to is some nerd is going to chime in how it runs between the patella, which is a bone, and the tibia, which is a bone, and because it goes from bone to bone, it has to be a ligament. Well, hate to stop you guys, but if we think about patella, the patella is what is called a sesamoid bone, which by definition means that it is a bone that forms within a tendon to help give that tendon better leverage around a joint. So if it's a bone inside of a tendon, that means the stuff that on either side of that bone in the tendon is still going to be a tendon. So it is the patellar tendon, not the patellar ligament. So we're talking about patellar tendinopathy today. Now, when we're dealing with pain in a tendon, what it really comes down to is whether or not that tendon is prepared for what we are asking it to do. That can be at a structural level at the tendon itself, or that can be at a perception level up at the brain. Either way, if that tendon isn't ready for what we are asking it to handle, it's going to tell us, and it's going to tell us by going, ouchie, this hurts. So if we got that ouchie, hurty tendon, what are we going to do about it? And the problem that a lot of lifters have is that when something hurts, they're just not going to do anything with it because they think that they need to make it rest in order for it to get better. And like, if you are squatting once or twice a week heavy and you go, ouch, this hurts, and then do nothing for the rest of your week, it's not going to do anything to help it get better, because for a tendon to be more prepared to handle work, we need to do work so that the tendon can get more prepared to handle work. And for a lot of lifters, that is going to be as simple as just doing bodyweight squats a couple times a day, every day they're not in the gym, and just by going into the bodyweight squat, slowly controlling their way down, loading into that tendon, flexing the quads on the way up, just doing slow, controlled reps over and over again, with the goal of making it feel better at the end of the set than the beginning, should be enough to push that knee in the right direction 99% of the time. Like, most of you guys could probably just stop watching this video right now, please don't for the algorithm, and then just go and do your bodyweight squats, and it should get better just doing that, because that little bit is going to push it in the right direction. For some of you, that might not be enough stimulus to get things going, so we could do a kneeling squat to give us more load into that knee. With the kneeling squat, we're just going to be sitting down, pushing towards our heels, getting a nice deep knee bend, flexing the quads up to the top. This is going to be more stretch for that tendon than the bodyweight squat, so it can be a little bit more stimulus. If you want even more stimulus, we can lean back. I'm top heavy, so I'm not going to lean back very far because I will tip over backwards, and you guys might want to watch that, but I don't want to do it, so we're not doing that today. That will be the next progression. Another way we can step up is to do the HEG split squat, which is going to be a modified split squat, where we are going to let the heel come up, go for as much forward knee travel as we can to really load into this knee. This way we're getting the range, we're getting the stretch, and we're getting more load, so that can be another thing that we can get good at away from the gym and in the gym as an accessory to help get that knee more ready to handle squats. Now, if we get really good at all of those, your knee should be good to go because that patellar tendon should be really prepared. But if doing all of that isn't fixing the problem, if it's still there, we got to think about how can we modify how that tendon is loaded so that it isn't being subject to so much load, so that it has a better chance of getting better. The first way we can modify how the tendon is loaded is just don't be an idiot and don't push your squats to the point that your knee feels like it's going to fall off. If we're trying to get over tendinopathy, we got to slow things down enough so that we are able to make steps forward rather than just like beating ourselves into the ground week after week after week and wondering why it isn't getting better. If we just keep pissing the thing off, it's going to get more pissed off. So manage loading in the short term so that it doesn't totally suck. Now, from a biomechanical perspective, one of the first things we're going to ask is whether or not you can actually get to full knee extension. Easy way to test that is to sit your ass on the floor, flex your quad, and see if your heel can pop up off the ground. If you can, sick, we probably don't have to worry about this, but if you can't and you're flexing your quad and it's just not moving, then we probably should do something about it. And the easiest way I've found to get some of that back is to do a modified TKE where we are elevating the toe. By elevating the toe, we're giving ourselves some leverage to drop the heel and force back and really try to shove through to that extension. You should probably feel some degree of stretch up through there as you're flexing the quad and pushing the knee through, and that should help us get that range back. We can load it with a band, pulling the knee forward, which can help us get a little bit more tension, which can help us flex the quad harder, which can help us push through. But either way, if you can't get that foot up on the floor, I would run these until you can, and then you can progress that to the TKE touchdown that we all know and love, where we're loading into knee flexion, pushing up through with the hip. And the big key thing here is that I'm getting a little bit of hip flexion with the knee flexion, then I'm trying to use quad and hip together to drive myself up to the top. The other thing I'm going to want to look at is whether or not that hip is working well enough, because out of breath here, talking while demoing is quite difficult. Because if we don't have enough hip flexion ability, the hip is going to be kind of like shoving the knee forward, which can put more load on that tendon. So what I want people to do with this is going to be some sort of single leg RDL, where we're going to be setting our brace. We're going to be then locking in, pushing into the hip, trying to make sure we're not getting knee bend, so we're just doing a weird Superman squat. We want to make sure we're pushing back into the hip, getting that hip. We should feel a stretch through the lateral hip. Then we're going to flex up to the top, push back, let knee come back till we feel a stretch, push back to the top, and we're going to try to gain flexibility through that, gain control of the hip through that. And once we can do it body weight, we're going to load it, dumbbell in the opposite hand, hinge down, and try to use that dumbbell to rotate us around for more stretch. Then we got to pull our way out of the stretch. So that's how we're going to attack from the hip side. And the last thing we're going to look at is whether or not we actually have the ankle flexion, so that we're not just having like femur trying to jam forward over tibia that isn't allowed to go. And we're going to go back to the yoga block for this guy. Easy way to kind of basically do the same thing we're doing with the TKE is just we're going to do kind of the same thing, except the goal then, instead of getting the knee to straighten, is to just get further and further into ankle flexion. We can do that to kind of begin to open things up. And then once that feels at least okay, we can get back down to the bottom of our bodyweight squat and then do calf raises in this position, try and drive the heels down more and more and more. So that's kind of the knee pain, patellar tendon pain toolkit. Basically what it comes down to is making sure that the patella is ready to handle what we want to do with it. And it comes down to making sure that we're able to access the positions that we need to be in so that the patella can do its job. So build up tolerance, make sure that our knee can get to full extension, make sure that our hip is letting the knee work, and make sure that our ankle is also letting the knee work. Thank you guys so much for watching. Peace out. Please, please, please click subscribe.